for a researcher, there's nothing better than seeing people run with your ideas and try to make change with it.
It's the story of a little union in British Columbia, Canada, and how they fought really hard to reverse privatization. It's a big win whenever we manage to deprivatize anything, and this was definitely a significant step. So a quick look at the media and the literature shows that most reversals of privatization are at the municipal level. But this deprivatization win was at the level of a big province in Canada. And so a province is the equivalent of a state. So known as the biggest mass firing in Canada, 20 years ago, the right-wing government of the province of British Columbia privatized 10,000 jobs in healthcare, mostly women and significantly racialized workers. A fraction of the workforce were then rehired by contracted out private companies at a fraction of the wage, no pensions, no workplace benefits. Most of the workers had been represented by an activist union known as the Hospital Employees Union, or HEU. So I'm going to be referring to them to HEU. They never gave up fighting to get these workers back into the public sector. Slide 2. So these are the contexts for this big win. And the first two will come as no surprise to you. It's a highly feminized and racialized sector. And we ran into the global COVID-19 pandemic. But another feature we had during the time of this big win was a social democratic government, which is fairly rare in British Columbia. And even more rare, it was not always disappointing. It was a government that actually seemed to have a feel for what people needed and was prepared to bravely step into that. It had very good ties with the HEU. The province also had the healthiest economy in Canada going into the pandemic and coming out. And very importantly, HEU was an activist union that really wanted to reverse the 20 years of privatization, and they had a strategy waiting in the wings. They were always ready to go after deprivatization when the moment arrived. So here we go. Let's talk about big win number 1. So big number 1. The union strategically built on the popularity of healthcare workers during the pandemic. So in Canada, healthcare workers were seen as heroes. They were seen as sacrificing deeply for the public. And so they argued that it was best for the public to bring healthcare workers back into stable, secure, well-paid employment because it would be easier to retain a dedicated and skilled workforce than if they remained privatized. They also argued that a stable workforce can more effectively combat the common threat of infection. And during and after the pandemic, it was a solid investment in the present and the future, and it was far more fair in light of all the workers' sacrifice and hard work during the pandemic. So deprivatization, at this point in time, is an ongoing process. So it's a rolling process. As private contracts come to an end, the workers are brought back into the public sector. So far, there's been 45,000 jobs brought back in-house in public hospitals. These are mostly dietary and cleaners, and they are expanding to new groups of workers. So the process has not ended, but it's a big, big win. And as you can see, the people in this picture are holding their brand new HEU union cards as they celebrate coming back into the public sector. Yay! You have to take the clapping off my time. Okay, so the second big win was something we saw in a number of countries. So single site staffing and wage leveling. The goal was to protect all long-term care workers. So everybody working in nursing homes, protect the workers, protect the residents, and protect the public during the pandemic. And they twinned a policy of restricting workers to a single site with no loss in hours. So this was a complicated kind of a policy, but it was effective in large part because they increased wages across the private, the public, and the nonprofit sector in nursing home care to the level of public wages. So this is key. Everyone got and continues to get public sector wages. And this was hugely significant. It played this ideological role because it delegitimized the idea that contracting out means that governments are going to save money. If it's going to cost just the same as public sector to run long-term care, then we might as well just make it public sector. So the union sees this policy as a first decisive step to rolling back widespread privatization in long-term care. This big win impacted tens of thousands of workers across the province. And you get a little glimpse of some of them there. And now my final slide. So in conclusion, deprivatization is possible and resistance is possible, even during major crises like global pandemics. Long struggles work, and they work largely because you have to be prepared. You have to be ready with a strategy that you kick into high gear when you have your moment and you leap in. So there are some more happy workers, some of them leaping.